Hello everyone, I'm Dr. Bang Seoleung, the hair wizard who protects your hair. It's a pleasure to meet you all. I believe this is a matter that requires an objective discussion and assessment. Honestly, if any of my patients are watching, you'll know that I let them use hair products right away. I only recommend they wait about 2 weeks for hair dyeing and perming. The reason for this advice is that the surgical method and the recovery process can indeed be quite different. So you've undergone a hair transplantation. Now, why are you advised against using hair products or blow drying your hair? It's out of concern that the transplanted hair might sustain damage or be adversely affected, correct? If the transplanted hair isn't damaged and there are no issues, then there's really nothing to worry about. With older transplant methods, if the incision site was large, leaving a lot of empty space around the transplanted hair, it could lead to bleeding, and any irritation could cause severe inflammation. In that case, you shouldn't apply anything from the outside. You can't even shampoo. Hair products are obviously out, and so are hair dyeing and perming. Because if anything gets into those gaps or causes irritation, it could be a big problem. So making small incision sites and performing clean transplants works well. There's individual variation. Even with the same procedure, some skin tears easily. For those patients, I definitely have them wait longer before using any hair products or touching the area. But since I'm directly involved, I can assess the situation. I'll tell the patient, your scalp is a bit soft and prone to tearing, so we'll proceed slowly. That's how I explain it. Since we can't definitively predict when someone will be able to touch their hair, it is crucial to establish a condition where avoiding any contact with the hair for at least 2 weeks is entirely safe and manageable. So, if you're considering hair transplantation, it's best to do your hair at least 2 weeks to a month prior. But what if you don't have that kind of time? In that case, it really depends on the clinic. You should definitely consult your doctor. However, at a minimum, once there's no pain, no bleeding, and the swelling has largely subsided, it's generally permissible to touch it. If you had incisional surgery, the sutures are usually removed within 7 to 10 days. After the sutures are out, you can style the hair around it. It might feel a bit strange, but it's not particularly harmful. A non-incisional procedure heals quicker, so speaking objectively, I'd say about 1 to 1.5 weeks. To be extra cautious, perhaps 2 full weeks. I have patients wear them right after surgery. The post-op anxiety is real. It's more comforting to hide it from others. So I believe the patient's peace of mind is what's important. I would let them wear one, but the same principle applies. You have to be certain that the transplanted area won't be irritated before you can allow them to wear a hat or a wig. However, most medical facilities will likely discourage it. This is due to their belief that the hat or wig can cause irritation and subsequent shedding of the transplanted hair. So this will likely vary by clinic. I place a hat on the patient myself on the day of surgery. As they're being discharged, that way I'm taking full responsibility, aren't I? For example, what if a clinic says, you can't wear a hat, you can't touch your hair? They literally tell you that nothing is allowed, then the patient must truly endure it for a whole week. But it feels so embarrassing and strange. So I tell them, I did a great job with the surgery, and from what I see today, it's perfect. I tell them I'll take responsibility. Since I did the surgery and put the hat on you, if any hair shedding or problems occur because of this, we can gladly do the surgery one more time. I joke that our connection will just grow deeper, but hair shedding doesn't happen. When those patients come back the next day or later for a checkup on their progress, there's absolutely no hair shedding. Therefore, you really shouldn't be overly concerned. Significant improvements have been made recently. There's no need to worry at all. Today, we delved into the topic of hairstyling following a hair transplantation procedure. I hope this was very helpful. I'll see you again. Thank you.